Have you ever noticed your hair thinning, your part widening, or your ponytail just not feeling as thick and wondered, is this normal or should I be concerned? Hi, I'm Dr. Jill Salyards. I'm a board certified dermatologist and the founder of Refine Dermatology here in Knoxville, Tennessee. And today I want to talk about female hair loss, what causes it, what to look for, and most importantly, what can we do about it? First, it's important to know some hair shedding is normal. We usually lose anywhere from 50 to 100 hairs per day, but if you're noticing increased shed or thinning through your part, decreased volume over time, that's usually a sign something more is going on. There are a few very common types of hair loss that I often see in women. This includes androgenetic alopecia or female pattern hair loss, and this is the most common type, showing up as a gradual thinning, especially along the part line. Another type is called Telogen effluvium. This is a more sudden shedding, often triggered by stress, illness, hormonal changes, or weight loss. Nutritional deficiencies or other medical conditions, things like low iron or thyroid issues. And then there are also some autoimmune forms of hair loss like alopecia areata, lichen planopilaris, or frontal fibrosing alopecia, where the immune system actually targets the hair follicle. Those are less common, but really important to recognize early because they do require a different treatment approach. The key is that different causes require different treatments. So getting the diagnosis right really matters. And when you come in, we'll take a detailed history and I will examine your scalp really closely. Sometimes I'll recommend lab work to look for some underlying causes. And then in certain cases, I might do a small biopsy if the diagnosis isn't clear. The good news is that we have a lot of effective treatment options, especially depending on the cause. The treatment might include things like topical minoxidil or other topical treatments. There are a lot of oral medications when appropriate, nutritional support if it's needed, and then in-office procedures like platelet-rich plasma or platelet-rich fibrin matrix, PRFM, to help stimulate hair growth. The earlier we start treatment, the better, and it's able to slow progression and improve hair density. One of the most important things to understand is that hair growth takes time. Most treatments take anywhere from 3 to 6 months to just start showing improvement, and consistency and patience are key. The main takeaway here is if you're noticing changes in your hair, it's very common, you're not alone, and there are things we can do to help. If you're experiencing hair thinning or shedding and you're not sure what's causing it, we would love to help you figure it out. At Refine Dermatology, we take a personalized physician-led approach to get to the root of the problem and create a treatment plan that works for you. I hope you enjoyed this video. I hope you learned something. Thanks so much for watching.